My name is Jeff Borer. I'm from State University of New York in Downstate in New York City. I spoke about the management of hypertension in the setting of valvular heart disease. First of all, hypertension is as prevalent in patients with valve disease as in patients without valve disease. So it's an ongoing finding, and I would say an ongoing problem. We do know from data that have been collected from a relatively small number of studies that the addition of hypertension to a valve disease, any of the common valve diseases, does impair outcome. It does add to the loads of the valve disease itself on the myocardium and leads to impaired clinical outcomes compared with not having hypertension. The problem is to know what to do about it. The reason for that is that all the drugs that we use for hypertension have other effects besides vasodilatation, and those other effects may be good or they may not be good in the setting of valve disease where there are exogenous loads causing myocardial abnormalities of other sorts. What we know so far is that in aortic regurgitation, clinical outcomes among patients who have hypertension can be improved by the addition of long-acting nifedipine. Those data come from two different studies, and I think it's fairly well established. However, other antihypertensive drugs may be neutral or actually negative, and specifically ACE inhibitors and angiotensin receptor blockers seem probably to be deleterious in the setting of aortic regurgitation. In mitral regurgitation, there are very few data related to clinical outcomes, but in fact, the same thing seems to be true. That is, ACE inhibitors and ARBs seem to be deleterious in the setting of mitral regurgitation. Most recently, we put together a preliminary study that was presented for the first time 2 months ago involving 56 patients from our natural history study. The patients weren't randomized. They were either put on drugs or not put on drugs by their primary physicians. Some of them had hypertension. Those with hypertension did not do as well as those without hypertension. But those who were given antihypertensive drugs did not do better than people without antihypertensive drugs. If they had hypertension, they tended to do better, but that was a very small number. If they didn't have hypertension and they were given antihypertensive drugs, again, the predominant drugs being ACE inhibitors and ARBs, they actually did significantly worse than if they weren't given drugs. So the conclusion is that hypertension is an important potential problem in patients with various forms of valvular heart disease, but we really don't know what to do about it yet.